The following portion of Living Local Carolina is sponsored by Moderna.
Alrighty, so guys, today I'm joined by Dr. Reed B. Tuckson. You are the co-founder of the Black Coalition Against COVID and the chairman of the board for the Coalition for Trust in Health and Science. Thanks for joining me today.
It's a pleasure to be with you and your audience.
Absolutely. So obviously the holidays are around the corner. We all want to make sure that we're feeling protected, and people need to know a couple things about COVID-19 whenever they're going to be gathering with friends and family. Tell me what they need to know.
Well, first of all, we are all aware that there are a lot of respiratory diseases circulating around, whether it's the atypical pneumonia, RSV, or the flu, or as we're discussing now, COVID. So we need to be prepared to prevent disease. The holiday season and colder weather means more intimate indoor contact. And that means viral diseases like COVID spread more easily. Our coughs and our sneezes can transmit particles more easily. And remember, COVID hasn't gone away. The virus continues to mutate. And unfortunately, people are getting sick and are still dying. So I'm here to talk about and pleased to partner with Moderna to help you as you make your personal vaccination decision. The overwhelming majority of health professionals and scientists think that everyone 6 months and over should get the updated COVID vaccine now before the holiday season begins.
And whenever you get the vaccine, how long does protection typically last?
We've learned a lot from the more than 655 million doses administered in the past. The data is clear that the vaccines are both effective and safe, preventing hospitalizations and death. But what we also know is that the vaccine protection wanes over time. The virus continues to mutate. Based on what we currently know, these vaccines should last for 6 months. One special note, those 65 and over and those who have immunocompromising conditions probably should receive an additional dose even after their 6 months or before sometimes their 6 months based upon what their physician guides them.
Okay, I gotcha. Now, say somebody had COVID this summer or recently, would you still need to get the vaccine, or how does that work?
Well, the simple answer is yes, you do. And here's why. Even those who already have had COVID-19 in the summer are still likely to get COVID-19 again. They are still at risk. So talk to your health professional. But the guidance following having a summer COVID infection is that it is recommended that you get vaccinated 90 days from when you received a positive test or the beginning of your symptoms.
This portion of Living Local Carolina was sponsored by Moderna.